Hello everybody. Today we are going to talk about the male reproductive system. In male reproductive system, we have different structures. Start with testis, continue with the different ducts, intra and extratesticular ducts, and epididymis, ductus deferens, and in the last part we have the penis. Now we're going to talk about the testis structure. As you know, testis present in the scrotum and have a structure like this, surrounded with a thick connective tissue from outer side. This connective tissue form a connective tissue structure in the middle side of the testis. This connective tissue in outer side, known as the tunica albugina, and this part known as the mediastinum. Testis. This connective tissue send some extensions or trabecules or septas into the inner side of the testis and divide the testis into 200 to 250 different sides like this. With these connective tissue structures, testis divided into the lobules. Each of these structures known as the lobules of testis. And this structure is the connective tissue. In the inner side of lobules, we have the seminiferous tubules. Seminiferous tubules. For example, here we have a seminiferous tubule, start from this part and convolute in this part, turn in the end part and again convolute and continue with this. This is our seminiferous tubule. Seminiferous tubule. In the inner side of each lobule, we have 1, 2, 4 seminiferous tubules. These tubules continue in continuous structure as not interrupted in the inner side of the lobes. Seminiferous tubules continue toward the mediastinum testis and form ducts in the inner side of the mediastinum testis, known as the rete testis. Continue in this part as rete testis, and again continue in this part as rete testis. The rete testis connected with seminiferous tubules with these small tubules, this part and this part. This part known as the straight tubules, or tubuli recti, straight tubules, or tubuli recti. Tubuli rectis connect the seminiferous tubules with rete testis. This part is rete testis. Rete testis and tubuli rectis, or straight tubules, present in the mediastinum. And in the peripheral side of mediastinum, the rete testis form about 20 small tubules. 20 small tubules. These tubules, known as the ductuli efferentes, or efferent ductals. We have about 20 of these ductals in each testis. These ductals connect with the epididymis. You know the epididymis? Connect with the head part of epididymis. And as you know, epididymis continue with the ductus deferens. Ductus deferens. In the inner side of seminiferous tubules and these ducts, we have epithelium. These epithelium will be different in different structures. For example, in seminiferous tubule, we have special epithelium known as the germinose epithelium or seminifer epithelium. In the seminifer epithelium or germinal epithelium, we have the Sertoli cells, and spermatogenic cells. Spermatogenic cells. In the straight tubules, in the beginning of straight tubules, we have only Sertoli cells. Cells, epithelium. Sertoli cells, epithelium. In the rectotestis, we have simple cuboidal epithelium. In ductuli efferentes, we have simple cuboidal and columnar epithelium. Simple cuboidal and columnar epithelium. In the wall of epididymis, we have pseudostratified epithelium. In the wall of ductus deferens, we have pseudostratified epithelium and columnar epithelium. And ductus deferens continue with the penile ureter. Now, we are going to talk about the inner side of the testis lobes. In the inner side of testis tubule and in the outer side of the seminiferous tubules, we have interstitial tissue in this part. In this part. This part. Known as the interstitial tissue. In the interstitial tissue, we have connective tissues, we have blood vessels, we have high amount of lymph vessels. And most important cell which present in the interstitial area, known as the, which cells present here? An important cell, cells which produce testosterone. Leydig cells. Leydig cells, most important cells present in the interstitial area. The Leydig cells have a role in production of testosterone and dihydrotestosterone. When we look at the inner side of seminiferous tubule, look at here. I'm going to cut the seminiferous tubule from this side and look at the transverse section of seminiferous tubule. In this part, I'm going to draw in a seminiferous tubule. This is a section from seminiferous tubule. And in outer side, we have the interstitial area, connective tissue, Leydig cells and different structures. Each seminiferous tubule from outer side surrounded with a connective tissue, a type of dense connective tissue. This connective tissue, this is the connective tissue, known as the tunica propria. Tunica propria, in some references, they told this is the tunica propria, present in this part. Connective tissue. And in the inner side of this connective tissue, in some areas, we have myoid cells. Myoid cells have a capacity in contraction and help seminiferous tubules to contract and push newly formed spermatozoas toward the rete testis, ductus efferentes, and epididymis. These cells are myoid cells, present in the wall of seminiferous tubules, present in this part, this wall. And this area known as the tunica propria. When we look at the inner side of the seminiferous tubule, we can identify longitudinal cells or columnar cells, the long cells which have a basement part in this area and continue toward the luminal side. These cells. And also we have a cell. And also we have another cell in this. Here you can see. These cells is our main cells, main protective cells present in the wall of seminiferous tubule. What is the name of these cells? Sertoli cells. Sertoli cells. Sertoli cells. What is the synonym of these cells in the follicle of female reproductive system structure? These cells have a role like granulosa or follicular cells. Okay? But here we have some differences. In the wall of seminiferous tubule, these Sertoli cells which have a clear or achromatic nuclei near the basement part connected with each other and form connection between each other. With these connections, the inner side of seminiferous tubule divided in two compartments. The basement compartment here and abdominal compartment. Abdominal compartment is this. This connection between the Sertoli cells form the blood-testis barrier. Blood-testis barrier formed between the connection of the Sertoli cells. In basement compartment of seminiferous tubule, we have the spermatogonias cells. Spermatogonias present here and here and here, near to the basement compartment. Spermatogonias. The genome of these spermatogonia cells similar the structure of male. And these cells, not foreigner cells to our immune system. Because of that, these cells can connect with the immune system. But during the meiosis division of these cells need to protect from immune system. When the spermatogonias start the meiosis division, this connection open between the Sertoli cells. The cell which enter into the meiosis division can pass through the connection and enter to this area. In this area, these cells have different DNA structure and a type of foreign cell for our immune system. Because of that, Sertoli cells protect these cells with the blood testis bank. Okay, can you understand this part? The spermatogonia cells is a type of normal haploid cells. But when enter into the meiosis division, the name of the spermatogonia changed into the primary spermatocyte. Primary spermatocytes, after finishing first meiosis division, form the secondary spermatocyte. Secondary spermatocytes finish the meiosis division and form spermatids. Spermatids, a type of haploid cells, not diploid cells. As you know, during the meiosis division, diploid cells change into the haploid cells, okay? Have only 23 DNA and chromosome in their structure. Can you understand this part? In the wall of the seminiferous tubule, in the abdominal side, we can see the primary spermatocytes, rarely secondary spermatocytes, and also spermatids. These spermatids, related with the reference books, sometimes known as the early spermatids. In the end of the meiosis division, or in the end of the spermatogenesis period, spermatogenesis, this stage known as the spermatogenesis. Our primary spermatocyte can form the 4 early spermatocytes. The early spermatids have a shape like this, have round structures, but very, very smaller than the primary spermatids. After this stage, these early spermatids enter to the spermiogenesis stage. You know the spermiogenesis stage from our embryology lecture. What is the spermiogenesis stage? Transformation from this round shape to this shape. A flat nuclei with tail and acrosomal head. This stage, changing from round shape to flat shape, known as the spermiogenesis. in the end of the spermiogenesis stage, our cell's name is spermatozoa or late spermatid. Spermatozoa or late spermatid form in the end of the spermiogenesis. In spermiogenesis, the number of cells not increase. We have only the transformation of the shape of cells, okay? Because in the wall of the seminiferous tubule, we have different stages of the meiosis division, and you can't understand the shape of this epithelium. We thought this type of epithelium is a type of special epithelium or germinal epithelium. Guys, the cells which in the different stage of the spermatogenesis and also the spermatogonia cells have a relation with Sertoli cells and connected with Sertoli cells in different stages. Connected with Sertoli cells with connexins, okay? And the Sertoli cells support these spermatogenic cells. How the Sertoli cells can support these cells? What do you think? Sertoli cells can give nutrients to the spermatozoas, can start the spermatogenesis stage, have a role in phagocytosis of the residual bodies and phagocytosis of the apoptotic spermatogonia, and protect the spermatogenetic cells from the immune system. Also, Sertoli cells can produce Mullerian inhibitor factor or Mullerian inhibitor substance. What is the role of this substance? This substance or factor can inhibit the formation of female genetic organs in males. If Sertoli cells can produce the Mullerian inhibitor factors during the embryonic stage, the normal male structures or male persons can have female reproductive organ structures, okay? The Sertoli cells have an important role in the transformation of and formation of the male reproductive system organs. We have a special division in the spermatogenesis stage. This is our spermatogonia. Or stem spermatogonia, stem spermatogonia. This spermatogonia start to meiosis division, mitosis division, and form two cells. One of these cells is a stem cell again, and one of these cells change into the type A. Type A spermatogonia. The type A spermatogonia again continue to cell division and form again type A. And these type A's again can form two other cells and form four cells. All of these cells, the type of spermatogonia, are present in this basement compartment and increase their number with normal mitosis division. With only one difference with normal mitosis division. These cells connected with each other with bridges. The cytoplasmic part of these cells not completely separated. Type A's form type B cells. Type B cells is our spermatogonias which ready to start the meiosis division and form primary spermatocyte. Primary spermatocyte. These primary spermatocytes form secondary spermatocytes, which again connect with each other, secondary. And secondary spermatocytes form the spermatids. Again, these spermatids connect with each other and have cell bridges between itself with spermatid. During the spermiogenesis, spermatids change into the spermatozoa. During the spermiogenesis stage, we have 4 different stages. The Golgi stage, the cap stage, acrosomal stage, and maturation stage. With these 4 different stages, the shape of spermatid changed into the spermatozoa shape. And we have spermatids with flat view. In these stages, in the apical side of the cell cytoplasma, you can see the acrosome formation. Golgi forms the granules, acrosomal granules, and then these granules merge to each other and form the acrosome structure. Mitochondria and other organelles migrate to the opposite side of the nucleus. The mitochondria form the middle part of the newly formed spermatozoas, and also centrioles migrate to the opposite side. One of them present in this part and form the basement compartment, and one of them go to the far side and form the tail structure. All of these events occur during the spermiogenesis. In the end stage of spermiogenesis, or in maturation stage, the residual sites of the cytoplasma and the bridge between cells phagocytoses with the Sertoli cells. And our spermatozoas free from the bridges and can release to the luminal side of the seminiferous tube. Disconnected with Sertoli cells and present in this. These spermatozoas don't have ability in movement, can't move individually from the inner side of the seminiferous tube to the retestis and the glia ferentes and the epididymis. In this stage, the myoid cells which present in the wall of seminiferous tube with contraction can help to this movement from the lumen of seminiferous tube toward the epididymis. Can you understand this part? Do you have questions related with the seminiferous tube and Sertoli cells and stage of the spermatogenesis? In English. Yes, Sertoli cells in last stage, phagocytosis the residual bodies. From the beginning of cell formation to the end of this stage, we have at least 7 weeks. Okay? The duration of spermatogenesis is 7 weeks. Why these weeks is very important? Because someone need to use some drugs to increase the quality and number of the sperms. If somebody use a drug today or from today, you can see the results of these drugs after 7 weeks. You can't see the result of the drug after 1 week. Okay? Because these drugs can affect the spermatogonia and Sertoli cells. Okay? And after that, you can increase the quality and quality of the sperms with different drugs. Okay, if you don't have question, let me stop our presentation in this part and continue in next one.